This is my first 2-minute pitch. It is on the case study number 1 on page 206, informed consent or not. In this case study, there is a 64-year-old multiple sclerosis, also known as MS, patient hospitalized, and the hospital recommended a feeding tube soon to help with her nourishment. She gave her consent, but the next day she became disoriented and confused about having to have the tube. The hospital revisited the question the next day when she was no longer disoriented, and she once agreed to have the tube placed. My thesis is that the physician should place the feeding tube as the patient gave her fully autonomous, informed consent, and it is in her best interest to have the tube placed. Here is an overview of my full argument. Now, let's break this down and discuss each piece separately. Number 1. According to the text, there are 3 things you need to have full informed consent. You need adequate disclosure to the patient must fully understand and comprehend the situation, and they must voluntarily agree to the procedure to have full informed consent. When the patient first gave her consent to having the feeding tube placed, she was fully competent in her decision. Also, when the patient agreed to have the feeding tube placed, she did have adequate disclosure from the doctor, and she understood the information when the idea was brought to her originally. When the idea was originally brought to the patient, she voluntarily agreed to have the treatment done. A reason that the patient is disoriented and confused the next morning when asked about the feeding tube again could be due to her MS, as MS is known to alter the path of information through the brain. When the doctors revisited the question again later, she still agreed to have the feeding tube placed. Therefore, she did give her full informed consent. Number 8. Beneficence urges physicians and nurses to promote patient welfare. By suggesting the feeding tube, the physicians are promoting the patient's welfare. Autonomy tells us that we should respect people's capacity for self-determination. The patient is fully autonomous in the decision of wanting the feeding tube. Therefore, based on points 8 through 11, the physician should respect her autonomy and place the feeding tube as she needs nourishment for her well-being. Thank you for watching.